Well, hi, Dr. Jennifer Taylor. We're so happy that you're here with us to share all your
Thank
wealth
you
of
for having
knowledge.
me.
You're welcome. Um, could you tell us a little bit about your professional background?
Yeah. So I started in chiropractic way back in 1991 as a chiropractic assistant. So I've been in this profession for a really long time, over 30 years now, I'm proud to say. And I decided eventually that I needed to become a chiropractor as well. I was a massage therapist for I had a massage therapist practice for 8 years, and then I decided I had to do more. So I went to chiropractic college, started in 2001. And in 2005, I graduated. I ended up getting married and having a baby. So I took a little bit of time off and I started my practice in 2006. So I'm actually on my 18th year in practice. And I am super excited to just share the knowledge that I have with you guys today.
Thank you so much. So, is there a story behind of all? Why is it that you have taken this path to help so many?
Yes. So as I was working as a chiropractic assistant for a chiropractor in Austin, Texas, there was actually a couple that came in one evening. They didn't even have an appointment. They just walked in desperate with this little bundle in their arms. And the doctor was actually needing to leave. And I ran down the hallway and I said, "Hey, I think there's somebody up here that needs you." And he walks up to the front. He had the same kind of look on his face that I did. Let's bring him back to the exam room and find out what's going on. And it turns out that it was a 12-day-old baby, a little girl. We'll call her baby Julia. And she, just a little background, a very traumatic birth. And she basically was given I don't think we can help this baby from the MD. She had severe sleep apnea. At one point, she stopped breathing up to 80 times per day. Like this, the apnea monitor was just going off. If you can imagine, these are brand new parents, first baby. And could you imagine for 12 days? They haven't really slept. So they look pretty haggard walking
Yes.
in. And I know it was crazy. And so at that point, I was working for what we call an upper cervical chiropractor, a specialist in the area that surrounds the brainstem. Now, as far as neurology is concerned, the brainstem controls all of your cardiovascular function. It controls all of your postural muscles, and it also controls all of your breathing. So if you can imagine a baby that had a really traumatic birth, a lot of tugging, pulling, twisting of the neck area just to get this poor baby out, you can imagine that area is probably damaged, in a certain way. But, you know, an MD is not trained to look at what we're trained to look at. It's like every profession has their scope of practice. And so they did everything that they could to help this baby, everything in their toolbox. And what we did was we took a look at this particular area to see if there was what we call a subluxation or misalignment of this upper cervical area. Well, we did a scan. It's called a thermography scan. And it looks at the difference in temperature on either side of the spine. And it determines if there's inflammation or irritation of that area. Any significant deviation from one side to the other will tell us that there's something going on. So in this particular scan, red means severe. So the most severe showed up on the scan at the atlas region. So that was primary to find exactly what was going on in this baby, because it's
Mhm.
very difficult for a 12-day-old baby to get x-rays on, because typically with adults we take very specific x-rays to find the vectors that we need. So what this doctor did was he used just his pinky, because when you're talking about a baby, the upper cervical bones really aren't fully formed yet. A lot of it is cartilage. So all he had to do is put his finger right behind her ear, do a little press, and all you saw was this baby go. and just screamed.
Wow.
That was the first time that they saw their baby take a deep breath in and cry. You know, when you have a baby, the first thing you want to hear when that baby is born is a good solid cry. They never got to hear that until that moment.
Wow.
So, I mean, everybody was crying, and I'm getting goosebumps right now just thinking
I'm
about it.
getting
This
this
was,
one
you know,
too.
forever ago, you know. And that was the day that I decided that I had to become a chiropractor. So I started my prerequisites because chiropractors, we do the whole pre-med route, just like an MD does. So in 1997, I started taking the courses to my prerequisites to go into chiropractic college. And in 2001, I started my journey in chiropractic college. And again, like I said, I graduated in 2005. So that day changed my life because I love chiropractic. I love being a chiropractic assistant. I took all the films, I did a lot of the exams. I love doing that part. And I love doing massage as well. But it was that day that I decided that I had to do something different. So that's my story.
That's an amazing story. And I hold dearly all the chiropractors out there because my story is one that my son had seizures like 18 a day
Oh my
when he
goodness.
was 2 years old. And all these
Wow.
doctors checking and a specialist, neural, thinking it was, but it was right after a fall, right?
Yeah.
And a
Yeah, we hear that a
chiropractor,
lot.
it's a long story, but long story short, my chiropractor, because my medical doctor or primary doctor didn't want to refer him to him, that was many years ago. And he will tell me, bring your son to my office. He will come down in his pajamas, adjust my son. He was 2 years old, because of the hit of the pan on the back. So it
Hmm.
was misaligned and he would get
Right?
triggered and start having the seizures, but it was like 10, 18 a day. He would
Wow,
do
yeah.
the adjustment, they will stop. And then the last one he had when he was 6 years old because it was, more steady the spine.
Yeah.
So anyway, I love you. It's an amazing job because you go our project is called root cause answers. And we're looking for the root
Hmm.
of the problems. And this is
Exactly.
our spine. So that's why I love to have you here with us, and a combination with many other things. So thank you for sharing. And one of my first questions,
Hmm.
Dr. Taylor, is that if you could explain how certain foods like caffeine, alcohol, artificial sweeteners, and processed meats can potentially trigger health complaints like migraines and neck pain.
Yeah. Okay. That is something that's part of the onion that we have to peel when it comes to migraines and headaches. Because, there's no two patients that are exactly alike. Even though they come in with a migraine or a headache, they don't necessarily come in with all the same reasons. Like I've got patients that can drink coffee all day long and eat chocolate all day long and it doesn't trigger their migraine. But aspartame, artificial sweeteners, equal is what aspartame is. And if you look at some of these different foods, some of these different triggers that patients can have, like alcohol, especially wine, like red wine, high in sulfites. Some patients are sensitive to sulfites in wine, and that can trigger a migraine or a headache. Dried fruits are also very high in sulfites as well. So if you're going to eat dried fruits, they actually make them now with no sulfites. So you can actually look on the package and you can see that. So if that's something that you like to snack on a little bit here and there, then you want to make sure you look for the sulfite free. Um, Artificial sweeteners, I don't, they offend me. That's all I have to say. Artificial sweeteners, especially aspartame, really, it actually causes a lot of firing in the brain.
Hmm.
And it will actually say that there are some people that are really sensitive to it. You can actually look on the back of a package and it'll have it in bold writing. It contains phenylalanine, and phenylalanine is something that can trigger migraines and seizures in some people. So that's something that people just need to know about, and it's in everything. It's in everything. Another one that I think patients really need to look at, it's important, we cook good food. We want to have some leftovers the next day, right? So
Mhm.
say for instance, you made lasagna with meat sauce. Lasagna is always better the next day, isn't it?
Yes.
So when they leave it in the refrigerator, that the meat in there, with it's still safe to consume, of course, for the next couple of days, but the histamine in those foods rise. So proteins that are left over, the histamine rises in them. So histamine can actually trigger a migraine or a headache in some people as well. So what we tell patients is, oh, we love leftovers. They're great. But what you need to do is the moment that you make it and you have those leftovers, freeze it immediately, and that will stop the histamines from forming. So you can have those lovely leftovers, but you want to make sure you freeze them immediately. So those are some of the things that there's many more. I could list probably 20 more, but those are some of the main ones that we typically see. Dairy sometimes can cause that with some people. Seed and vegetable oils, because they're rancid, can cause issues like canola oil. No, canola oil will give me a migraine. You know, um, so that's something that you want to watch, these seed or vegetable oils as well. So those are some of the things. Now, there are great brain foods that you can eat. So think of them as brain foods. So salmon, spinach, chia seeds, mushrooms, like the medicinal mushrooms are always great. Lentils, pomegranate. Those are some things you can eat in abundance that are going to help decrease inflammation in the body. So those are some of the foods that we tell patients to eat in abundance. Again, I could give you a list of 30, 40, 50 more, but those are some of the main ones that we say kind of rotate into your diet as well.
Could you share your thoughts on the importance of hydration in maintaining overall health, and specifically for patients with conditions like migraines and post concussion syndrome?
Oh, so hydration is key for a human being, no matter what. And what you want to make sure to look for is you want to drink half your body weight in ounces per day. So whatever number that is, you don't want to exceed a gallon. There's no reason to exceed any more than a gallon per day. Um, but say for instance, you weigh 150 pounds. You just divide that number by two, and that is how many ounces per day that you drink. So shoot for that. Like for me, I try and shoot for at least 2 liters a day. I don't always make it, and I do 2 liters. I don't really need to have that full 2 liters, but I do have coffee or tea in the morning. So that's something that depletes, anything with caffeine in it is going to kind of take away from that. So I try and counterbalance that and shoot for at least 2 liters a day. If everybody just shoots for 2 liters a day, an adult, I think you'd be well hydrated. Now, when it comes to headaches, typically a migraine will start off as kind of like a mild headache. You feel it back here and it just starts to move forward, typically more on one side. And I say, okay, how much water have you had today? And what's funny is that I find a lot of migraine patients are chronically dehydrated. And partly because when when we're dehydrated, um, a lot of these patients say, well, I just don't get thirsty. I'm like, okay, well, I dove a little further into that. Well, why don't you get thirsty? Well, I'm always busy. Da, 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 I always have to go to the bathroom. There's those things, but there are patients that do not get thirsty. There's no thirst mechanism that's coming on. So to understand why this patient's not getting thirsty is you have to understand the vagus nerve. The vagus nerve is it's one of the cranial nerves. It's cranial nerve 10, and it's actually called the wandering nerve. And it goes all the way from the brainstem, it touches every single organ all the way down to the large intestine. And it's responsible. Its main response is to actually balance out the autonomic nervous system, the part of the nervous system that you don't have to think about. You don't have to think about, okay, heartbeat, okay, food digest. The autonomic nervous system does this for you. This nerve regulates that. It balances it out. Now, when the atlas or upper cervical, the first vertebra in the neck, this is the upper cervical region I'm speaking of, when that is out of alignment, it actually can press on that vagus nerve and compress it. We can actually see this on MRI or CT.
Wow.
You can actually see that area compressed. So, I actually have a little picture of it. Let me show you here.
Yes. Any visuals? I love them.
Okay. Yeah. So let's see. We've got this right here. Can you see this right here? So we're looking from the top. We're looking down. So this right here is a spinal canal right here. So you have your carotid, you have your internal jugular vein, and there is the vagus nerve, that yellow one right there. So if this rotates, so this bone can rotate, it can shift, and it can tilt. So when it rotates, and it can press on these particular nerves right here, on the nerve and these vessels as well. We'll talk a little bit more about this vessel, the blue one right there, the internal jugular, or the internal jugular vein. That is something that is unique, not only to migraine patients, but also to vertigo and dizziness patients as well. So that there's a correlation there between the two. So when the vagus nerve is compressed, now your body defaults into fight or flight. So when you default into fight or flight, now your body's under stress. The more stress you're under, the more the body wants to hang on to sodium. If you get thirsty, you're going to flush that sodium out. So this is how smart your body is. It says, no, you need more sodium. Your body is stressed out. So the thirst mechanism is turned off, so you can keep in that sodium, so you no longer get thirsty, so you don't flush that sodium out because your body's just trying to stay in fight or flight.
So that's when
So
you're
see how the
lacking of
body is so intelligent?
sodium. When you lack of sodium, then that's what happens, and you don't get thirsty.
Yeah. Well, when your body wants to hang on to it.
So hang on to it.
When your adrenals are pumping out that cortisol because you're just in fight or flight, that you're always looking for that tiger around the corner, then your body wants to hang on to sodium to continue to make that cortisol, to continue to keep that fight or flight function going. So I'm in awe as to how smart the body is. Now, this is not something that you should have to do forever, right? You can't stay in this state. But this is why people are chronically, not thirsty.
I just experienced that with my aunt. I have my aunt. She just had a tumor, and it was removed. She was very sick, and my mom is helping her. And then my mom got sick. That's why I'm here helping both of them. And I'm after her. You need to drink water. I'm not thirsty. I don't want to drink water. And she just told me that they said she's low in sodium. So I'm making the connection here with what you just said.
Yeah, exactly.
Incredible.
Exactly. Yeah.
So then how do you fix that?
Well, we have to make sure the pressure gets off that vagus nerve, right? So now this may not be in all cases, but when I have somebody that comes to me with a migraine, and this is a lot of times it's been chronic, especially with women. It typically starts in preteens when they start their menstrual cycle. We usually see an influx of inflammation during our cycles anyway, naturally. So if there is inflammation anywhere in the body, it's gonna rise. It's gonna be even more apparent. That's why migraines typically start during that time. There's a lot of other cascades of hormonal imbalances and things like that I won't get into, but that's typically why we see it start in preteen years. So typically I'll see somebody, our demographic really with this particular thing is about 35 to 55 is where we see I see patients come in finally for this. I'm typically their last stop, unfortunately. But what we need to do is we need to find out, okay, is this area misaligned? Now we do that by doing some very specific films. We do a side view of the neck to kind of see how the structure of the spine is from the side. we want what we call a backward C shape in that area. Okay, it provides shock absorption in the area. We look for that. We look for degenerative change, anything like that. Then we take one from the front. We want to see exactly, has it shifted right or left? Is it tilted up or down? How is it sitting in this plane? The last one we take in this series is called a vertex. So we're actually looking from the back and looking down. It looks like that picture that I just showed you. Okay, that way we'll see how much it's rotated. So what we're looking at is this bone right here. Now I've got a model. Can you see this right here?
Yes.
Okay, so this is the back of the head right here. Okay, this is the back of your head right here. And your head sits right on top of the atlas. Okay, they call it the Atlas because have you heard the Greek god Atlas that holds the whole world up?
Yes, yeah.
Those anatomists are just they're just very cool when it comes to all their Greek gods. They love them all. So your skull sits right on top of the Atlas. Then you have C2, which is called the axis, and that sits right below it. What you'll notice is there's no disc above or below this area right here. Okay, this right here is held together by a web of ligaments. That's how we have all the movement that we have. So it's kind of damaged here, but this right here is where the disc starts, okay, between C2 and C3. So what we're looking at is has this shifted right or left? Has it tilted up or down, or is it stuck in rotation? So we get those vectors from the film. Those vectors give me not only where the atlas went, but also the specific vectors to put it back in proper alignment. You know, I encourage anybody that is listening to this to go to my website, because not only do I have a fun little tool that you can play around with, that you can see an animation to do that. So if you want to go to drjenntaylor.com, it's drjenntaylor.com. You can actually see how this misalignment not only looks in an animation, because it's kind of hard to see in this, but you can also see what a first adjustment looks like, what an atlas alignment looks like. I filmed an entire video on what it actually looks like to get your atlas adjusted. Number one, it's gentle, it's precise, and everybody gets their own personalized alignment. There's no two people that have the exact same vectors, if you will. So everybody comes in and everything is very, very personalized. So when we adjust a patient and we take that pressure off the vagus nerve, we take the pressure off the internal jugular vein, we start to see that pressure decrease in the head, decrease. A lot of times I have patients that have long-term migraines, they have fullness in the ears too, so it can affect that as well, which can actually cause that balance or equilibrium problem. So by removing that interference, if that mechanical issue is there, then what we can do is we'll start to see that inflammation decrease, and we'll start to see more structural balance throughout the entire spine.
Going to the root of the problem and then finding the solution.
Yeah.
And I wanted to ask you just off the, I wanted to ask you first before we continue the questions that I have by topics. If you could explain, because some people might even know what a chiropractor does.
Well, the number one thing I'm going to say is what we don't do. Chiropractors, we don't treat diseases, we don't treat illnesses. There's not like a magic adjustment for a certain illness or disease. What we do is we remove the interference to the most important system in the body. When sperm meets egg, the first thing that forms in that womb is the nervous system, even before the heart starts beating. So this is the system that controls every other system in the body. So what we do is we find the misalignment or subluxation, we detect it, we correct it. Therefore, your body can do exactly what it's supposed to do. We like to call it audio. So from above, down, from the inside out is how we should be healing. you know. That's my personal belief, that God does the healing. I just remove the interference. I find it, remove the interference. We have our own best doctors within us. And if your nervous system is functioning the way it should, then you can actually heal yourself. Now, there could be underlying issues that have been there as well, like, we talked about nutrition and things like that. But you can eat all the organic foods on the planet. You can take all the best supplements that there are. You can do all the yoga, the Pilates, the stretching, the exercises you can do. But if there's a mechanical issue,
Mm.
especially at this particular area, I like to call it the master breaker of the nervous system. If there's a misalignment in your spine, then there's no food or supplement that is going to correct that. It needs to be detected and it needs to be corrected, and that's what chiropractors do. We look at the foundation of the body. The nervous system is the foundation. There's nothing else that can work if the nervous system isn't functioning properly. So that's what chiropractors do.
I love it. I love it. Yes, it's so removing that will help your body heal itself. And with that, you had mentioned even if you get non-organic, I mean organic foods and all the things that you do, but it's part of the healing too. I believe after you
Absolutely.
have your body aligned, so that's why chiropractors are so
Yeah.
important. It's part of the whole
Yes, because
combination of
we look at
healing.
the biochemical. Yes, we go from the biochemical to the clinical level when we look at nutrition, because once the misalignment is corrected, then you need the building blocks to help heal the tissue that's been damaged for so long. And that's where, detoxification comes in. And that's where good organic foods come in. That's where good exercises come in. That's where meditation comes in. I mean, meditation and prayer, those are things that also heal, because we're not just healing the body, we're healing the soul as well. When we really want to heal from a cellular level, we really need to make sure we do all those things.
Mhm. So, as a chiropractor, specializing in conditions like migraine and vertigo, how does regular
Mhm.
sleep, relaxation, and deep breathing techniques contribute to managing these health complaints?
That is a wonderful question. Okay, so I'll break it down a little bit, and I'm going to start with sleep.
Okay.
Sleep is probably the most important thing that you can do for your brain. And the reason I say that is because sleep is the only time that your brain cleans itself. It's the only time. So if you are not getting adequate sleep, then your brain is not draining. Okay, so we found out, I want to say it's been a decade or maybe a little bit more. Scientists actually found out that the brain has its own immune system. Its very own immune system. They actually call it the glymphatic system. And the glymphatic system, it flushes only when we're sleeping. So if we're not getting adequate sleep, that is something that is going to predispose us to foggy brain, concentration issues. They're even now linking, you can actually find several studies indexed in PubMed where they're actually showing that lack of sleep, especially over an extended period of time, can lead to other neurological conditions like Parkinson's, MS, um, uh, you know, Alzheimer's, dementia. All those things can be caused or contribute to. They don't really like to give a cause, but definitely a contributory factor to all these neurodegenerative diseases. So sleep, I would say, in that list is number one. You've got to get adequate sleep. And for an adult, it's 7 to 9 hours per night. Yeah, I know. Most people go, oh, oh no.
I have to work on that.
But it's exactly. And it's hard sometimes. And every once in a while, we're not going to get the greatest of sleep. But, having sleep rituals at night, I think is really important, especially for those that have difficulty sleeping. I am one of those. I've had difficulty sleeping since my preteens. And So at night I have specific things that I do that basically tells my brain, okay, it's ready, you're ready for bed. So some of my favorite ones is I like to read before I go to bed. I like to have a cup of tea before I go to bed. That warm tea, it's herbal tea, is so soothing to me. Um, I also just it's like little things. Yeah, I once I get into bed, I'm in bed.
Mhm.
It's also telling your family, okay, what do you need? Make sure that you give me all your needs, because there's sometimes there's nobody that can help but mom, right?
Yes.
My kids are older now, so they're really taking care of themselves at this point. But um, I want to make sure that my family knows that once I get into bed, it's really important that I stay in bed, that I'm not interrupted, because it's like this winding down that I have to do. And make it sacred, because again, this is where you heal. This is where your brain heals. You can't be good to anybody, your family, your coworkers, your pursuit of happiness, if you don't have adequate sleep and you're not great the next day. So we're all going to have times when we're going to have just a really bad night. But if that is every single night, every night over and over again, then that's when it becomes a problem. Um, so figure out what your sleep rituals are, and even waking up in the morning, I think is really important to make sure you have those same rituals. Waking up, in time to slowly wake up, to get out of bed and not have to rush. A lot of
Okay.
people they think that they're sleeping in and they're getting the most sleep possible, but you're really not. Not at a certain point in time, your brain is like, you got to get up, you've got things to do, and then it starts getting into fight or flight. So getting up at um, going to bed at the same time every night within an hour, you can give yourself some wiggle room, and
Mhm.
waking up at the same time. This is even on the weekends. You want to make sure you do that as often as possible. Again, you're going to be on vacation, you're going to get all off time and things like that. So I'm not being a stickler for every single day,
Mhm.
but for the majority of the time, you want to make sure that you go to bed at the same time and you wake up at the same time. And when you wake up in the morning, have a slow wake up. Have some morning rituals. Like, again, I like to have my cup of tea. I like to do my devotionals and my journaling. That just gets me in a good frame of mind, because I'm taking care of a lot of people every day, and I want to make sure that I'm present for them. So I just write it all out before I walk out the door. And that way I can be present for each and every person that comes in front of me. So
What
those are some
about
things. What
children?
other areas did I mention?
Oh,
Was that
it was sleep. But you mentioned about adults that we need like 7 to 8 hours, right? And what about
seven
children?
to nine
7 to
seven to
9.
nine hours. Uh, yes. So um, babies, their babies are kind of off the charts. They need 12 to 14 hours, and I mean there's some schools that say even need up to 18. I mean every child is different, but they're on and off a little bit, for infants and babies. Um, as far as your teens and preteens, they need about 10. They do need more sleep. They are rapidly growing. Their hormones are off the charts. They need about an average about 10 hours, 9 to 10 hours a day. Now again, you're gonna find all different schools, saying different things. But I would say at least 10 hours for your teens and preteens is really important.
Does it matter? Is there a benefit to go to bed at certain time in the evening?
Yeah. I know I'm going to squash some people that are night owls and everything, but really you need to be in bed and sleeping by 10. 10:30 is when this cycle starts.
Okay.
That's their circadian rhythm. So 10:30 is typically when this particular cycle starts. So you need to be in bed by 10.
Hmm.
And typically it takes between 10 and 15 minutes for people to really kind of calm down and get to sleep. That's average. Some people
Hmm.
can go to sleep just like that. Some people will take a little bit longer to go to sleep, but that's why I give that about a 30-minute window before that. So
Okay.
by 10 o'clock.
Okay. And okay, the next one was relaxation and deep breathing. Does that contribute to help with these complaints?
Yes. So most of us are really shallow breathers. So
Yeah.
I can't tell you how many times where we're blowing and going all day long and we realize, oh my gosh, I haven't taken a deep breath in. You know, so you want to make sure that you're getting that regular breathing technique. I think yoga is an excellent thing for people to do, even if it's just for 10 or 15 minutes, just to get that breath in. That is a really good practice. But then you also have like things like meditation where you can also do that. Prayer where you also can do that deep breathing. Now, what's really important is you're breathing from the right place. So patients that have had, a lot of asthma in their life, they tend to breathe from up here. And that tends to move the head forward. We move the head forward, that actually even increases our disability basically to breathe. So we can't do this. So if we were to do like an experiment right now where shoulders are back, heads up, breathe in through the nose and out through the mouth, you want to make sure you're breathing from your belly. Okay? But what if you did that same thing, bring your head forward like this and try and take a deep breath in?
Yeah, very difficult.
Can't do it, can you? Okay, so that forward head posture, that actually can decrease our lung capacity by up to 30%.
Wow.
So now I want you, this is going to be homework for everybody, is to now walk around and look around at everybody that's walking around like this. We're all doing it. You know why? Because we're all looking down at our phones 24/7. Okay, we're all on computers all day long. So that forces our head forward. That causes problems with our lung capacity. And that also causes misalignment or subluxation at the atlas as well. So those are some things. So see how it all correlates? Yes. So when it comes to deep breathing, you got to breathe from the belly, not from up here. And make sure if you have a history of asthma or other breathing disorders like COPD, practice. Lie on your back. This is an exercise I give patients all the time, is lie on your back in a comfortable position, put some books on your belly, and I want you to practice taking a deep breathe in your nose, and I want you to lift those books and breathe out through your mouth. So you actually become accustomed to it. So you actually see those books move. So that's kind of a retrainer. You can do that 1 to 2 times a day just to retrain your body to breathe properly. So that's a good exercise. And a great relaxation technique is called Emotional Freedom Technique, or EFT. This is something you can find on YouTube. They even have videos for children as well. It works really great for things like phobias or traumas, things like that you need to get over. So I'll give you a little information on it. So it's actually pretty fun, especially to do this with children that have a little anxiety, or they're scared of spiders. We'll just say they're scared of spiders. Okay. So phobias in general, what are they? They're irrational fears. Okay. Spiders are not coming to get you. Logically, we know this. Maybe a kid may not know this, but as adults, we know this, right? But you're definitely afraid of spiders. So what we'll do is we'll start off, there's a place called the karate chop point right here. And what you'll do is you'll tap that. Just sit here and tap it and go, I want you to acknowledge your fear. Acknowledge that you're afraid of spiders. Spiders are really scary. They are really ugly. They could bite me. My arm could fall off. All those irrational fears, just let them go and acknowledge them. You have to acknowledge the fear before you zap it. Okay? So we start that off at the karate chop point. Now you're doing the affirmation part. The affirmation part are using these acupressure points. So you start at the top of your head and you say, I really don't like spiders.
I really don't like spiders.
But you know what? I bet they really don't like me. Yeah, they're probably more afraid of me than I am. Spiders, they eat all the bad bugs. I live in Texas. I don't like all those bad bugs. They need to eat them. So if I see one, I am going to make sure that I just kind of scoop it out and gently put it out into the backyard. There's no reason for me to be afraid of spiders. No reason. and the other one is underneath the arm right here. So you do that 3 times, and you just say those things like, spiders are pretty cool, and you just start saying those things to kind of zap that irrational phobia, that irrational fear. And if you gave it a number of a 10, that, if you see a spider, you're going to completely freak out and run out of the room and try and find, a flamethrower. At the end of that 3 session, give yourself a number. I bet you'll be about a 2 or a 3, and you'll be laughing at yourself that you're afraid of spiders.
I
So
am going
now
to try
it may
that
take some
because I'm
reinforcement.
scared of spiders.
Okay, well, see, I knew that.
Yeah, I was going like this. I
So
said, I'm gonna try it, doctor. Amazing.
try it. And again, you can find this. It's free. It's called Emotional Freedom Technique, and it's fantastic. You can find a bunch of fun videos on YouTube. So that's some of the things that we give patients for just relaxation in general. I mean, we can actually have somebody come in and just be upset about something, just crying. Maybe something happened that day that made them very upset, and their blood pressure is rising or something. We've actually taken somebody's blood pressure, and it was high, not like crazy high or anything, but you could tell it was tacky. They were tacky. Their pulse was just out of control because they were just really upset. And we had them go into a nice quiet room by themselves, because it's kind of weird to do in front of other people. But we took their blood pressure, and then we had them do the full cycle, and then we took their blood pressure again, and their blood pressure and their pulse were normal. So it's really cool to see things like that. Now, is this a treatment for anxiety or anything like that? No, it's basically a way to kind of tell the nervous system it's okay to calm down. And I think that's where a lot of our anxieties and things come from, is that we're just long-term dealing with things and not knowing how to release it. And it's just getting stuffed and stuffed and stuffed. And then it becomes, a visceral issue. It becomes, a major issue in our lives.
Yeah, thank you
So I
for
think
this
I got
very
all the
practical, very practical help
Yeah.
idea that it could help. Yes. So now we're going to talk about overcoming stress and illnesses. So, how crucial is
Okay.
regular exercise to the patients you treat, especially those with the migraines again, and neck pain, vertigo,
Mhm.
and concussion syndrome?
Yeah. So exercise is really important. I'm going to take post concussion syndrome out of that for a moment, because they're a little bit different how we apply exercise with them. And we can talk about that momentarily. But when it comes to the typical patients that we see with the neck pain, vertigo, dizziness, things like that, there are certain exercises that we do give. Probably the biggest one we give is a range of motion exercises. There are some exercises that we do like and some exercises that we don't like. I don't with vertigo and dizziness, as well as migraines, I don't like anybody forcing their head into this lateral flexion, because if this area is compromised, the ligaments in there could be really lax. And so we don't want to pull those particular ligaments in that position. The range of motion exercises that I typically want patients to do is just a rotation, back and forth, come back to center, back and forward, like this. Just your typical ranges of motion. I want them to, they can do them sitting or standing, really important as well. And, range of motion exercises are really important, because we typically are sitting in one position for 8 hours a day, especially for patients that have to sit at a computer all day long. I mean, that's the nature of what we do as, our jobs these days, is sitting at computers, unfortunately. Or if we're not at a computer, we're on our phone. So getting regular stretching exercises is also really important. So in my office, what we do is based on posture. Before and after the atlas alignment is how we determine very specific exercises for patients. So I mentioned before that when the atlas is out of alignment, that it actually puts pressure at the brainstem region. The brainstem region controls all your breathing, cardiovascular function, but it also controls all of your postural muscles. So when your posture is affected by this atlas misalignment. It actually causes, typically on one side, it'll cause a muscle spasm. So we'll see a shoulder high, a hip high. It torques that hip backwards and it pulls a leg up. So we actually see one leg appearing shorter than the other. That's one of the first neurological signs that we can find. So we see that beginning posture, we do the atlas alignment, and then we take another posture picture and analyze it using a specific tool that we use to analyze the pictures before and after. And what we find is that there are some muscles that are like, yes, thank you so much. Shoulders start to even out, head comes back, but there are some muscles that are like, not going to do it. All right. So what we do is, again, not only do patients in our office get a very specific precision adjustment to them, but we also provide them with specific exercises unique to how their body responds after an atlas alignment. Because again, no two people heal exactly the same way. And no two people's lives are exactly the same way. There is somebody that probably sits at a desk all day and somebody that does manual labor all day. They're going to have different muscles that are firing differently. So we need to make sure we find out what muscles, really like that, or what muscles are still guarding so much that they need a little extra help. So we put together those specific exercises to target those muscle groups that need those extra help. So in our office is, again, very specific to each patient, but those range of motion exercises in the neck and also range of motion exercises for the low back are typically standard with each patient. But exercise, it's important. We should be like sharks. Once we stop moving, we're going to die. Movement is life. So let's keep our spines and our bodies moving.
Yes, that's a good analogy. As a healthcare professional, how do you promote the importance of maintaining a balanced diet and consistent sleep routine to your patients?
Wow. It's usually something that we talk about kind of piecemeal each way. When it comes to giving patients advice, I think it's really important to know where they're coming from. I have patients that don't even know what real food is. I mean, that sounds really weird, especially to this particular audience, probably. But they'll write me down a 2 or 3 day food diary just to kind of get an idea of what they're eating, especially with migraine patients, to kind of know exactly if there's any triggers that are in there that they're eating in abundance. And when they write that down, I'm like, there is no food on this paper. It's all processed. It's all the seed rancid oils. But people have created a life that they can't, either they don't know what real food is, or they feel like they don't have time to make real food or source it even, so when it comes to teaching people about how to eat, you can't throw everything all at them. There was a time when I was so passionate about that, but it was like people just said, well, I can't do it. And they just threw the baby out with the bathwater. So it's really finding those little increments of things that they can do a little bit at a time. If you ate one vegetable a day for 1 year before you ate no vegetables, would you be better off at the end of that year or worse? So it's those little changes that make all the difference in the world to a patient, that they, I can do this now. So once they see one victory, they can do the next, and they can do the next, and they can do the next. So really it's finding out where that patient's at. I mean, I can probably I'm thinking right now 2 patients that are just like gung-ho, and whatever I tell them to do, they are going to do it to a T, and they really do it. 99% don't. And it's not because they don't want to. It's not because they don't want the outcome. It's just that they don't see how it's going to fit into their life right now. So that's where you have to kind of come to a crossroads and say, okay, would you feel more comfortable just starting with supplementation, just to kind of fill in the gaps? So we'll start there. Then we can start moving on to any of the other things. Like, okay, let's just start with dinner. Start with a good quality protein and some good fresh vegetables. Make it simple. It doesn't have to be hard. And when they have, again, those little victories, they're going to make those wonderful changes. Same with the sleep. Starting with those sleep rituals. Let me give you just a few little pointers. We'll start here and then we'll unfold. Because there are some people that just get that second or third wind at 11 o'clock at night. I am not one of those people, but they do. And I have to make sure that we acknowledge that and see if maybe we can tweak it a little bit.
It is so true that, it's very hard once you have that routine or the way you do things in life, it's very difficult to change it. And then you give up when you can't stick to what you want to do. But starting little by little,
Yeah,
like you
I
said,
asked for 3 weeks.
that's
Yeah,
great.
it takes
That's
3 weeks to make a habit.
3 weeks.
You probably
Okay.
heard that before.
Yes, I
Yeah.
have. Yes, but you can change it in so quick, not continue it, but
Mhm.
you can it's doing that step by step and be compassionate, I think, and understand where they're coming from, like you said. And because
Yeah,
sometimes, with the family members, we try to do things, and I have to remember, just be patient and love them, and
one step at a time. Yep.
exactly one step at a time. Dr. Taylor, for those unfamiliar with the term, uh, could you explain what upper cervical chiropractic care is and
Yeah.
how it differs from the traditional chiropractic treatment?
Well, what I love about chiropractic is it all works. I love chiropractic no matter what. Last I heard, there was over 200 different techniques within the chiropractic profession. So what I like to say is that chiropractic works, but not every technique works for every patient. So you've got to find the technique that works for you. And so with upper cervical, it's really a specialty within the chiropractic profession. So there are just under 100,000 chiropractors that are licensed between Canada and America. So you've got about that. I want to say the last I heard maybe was 85,000 that are 85,000 that are licensed to practice between Canada and North America. And there approximately are only 1,200 of us that practice the upper cervical work. That's it. So we are a specialty. And then you take, if you'll notice that there are extra letters after my name there, that DCCJP, that stands for Diplomate of Chiropractic and Cranial Cervical Junction Procedures. It's a mouthful. However, that is an extra designation that says that I took an extra 3 years to study just this particular area and pass boards in order to get those extra letters. And there's less than 100 of us in the world that has that designation. And this particular program has actually been going on for now 10 years. We're about to enter in January. We'll start the next class. So it's pretty incredible how I'm trying to get the word out there about this, not only because I think that patients that have tried chiropractic and have thought chiropractic didn't work for them, maybe this is the technique that will work for them. And also, I'm trying to get the word out to other chiropractors. Say, you need to do this technique. You can't just say you do, you have to train for it. You have to know how to take the films. You have to know how to analyze the films. You have to know how to properly execute this procedure so the patient is actually going to see and feel the difference that day they get that first adjustment. So it's kind of a shout out, like, hey patients, come on, humanity needs this. This is the greatest health secret nobody's ever heard of. And I've seen so many patients come in, I'm their last hope. Basically, there's a lot of pressure. Okay, they come and say, I've spent $10,000 here, $20,000 here. If this doesn't help me, then nothing will. So I mean, there's patients that come from all over to see me, and I want to make sure that there are chiropractors in every state and every city, so people don't have to travel so far to see these specialists. So that's part of my reason for being on these podcasts, because and these documentaries, is because this is so important that people understand how important this master breaker area is. The cranial cervical junction is the most neurologically dense area of the nervous system, and if it's not functioning properly, your entire nervous system isn't going to function properly. So we need to figure out if that's the issue. And if that's not the issue, then obviously that would be out of my scope of practice, and I need to find you somebody that can help you. But if it is, it can be part of the puzzle that you've been missing for decades. So I just, the importance of getting this information out, and for people to understand is really important. You know, your traditional chiropractic care, I think is pretty amazing as well. They help a lot of people. There's also a subset of people, like I said, that feel chiropractic has failed them, which it hasn't. They've gotten help from traditional chiropractic, but maybe they need something a little bit more. And I also work with chiropractors that don't do upper cervical work, and I check their atlas, I make sure they're functioning right, and I send them right back, you know, so they can get regular care, and they just come back and get checked periodically, and I'll do that part. So again, that's another way that we work in our office as well.
It's great that you're working together, and especially letting the world know about this, because it's important that people get educated. Doctors, you know, they have their specialties, but if there's something more that it will help patients, that will be great. And you're in the right place. A lot of people are going to hear this message, because that's what we want, people to heal and feel better. So could you share some
Yeah.
examples of conditions that you've treated using orthospinology? Maybe you can help me pronounce this. Orthospinology
Yes.
techniques.
Yes. So orthospinology is one of the techniques under the upper cervical chiropractic umbrella. There are several of them, and that is the one that I practice.
Mhm.
So there are ones, there's NUCA, there's Epic, there's knee chest, there is Atlas orthogonal, there is advanced orthogonal. There are many that are underneath the upper cervical umbrella. So these are different techniques. They're all wonderful, and they all want the same thing. We're all going to get that atlas back in alignment. They just use either a different type of instrument, or they use their hand, or even a Blair, which is an upper cervical technique as well. They use their hand, but they actually have different vectors and different types of x-rays that they look at. So, and a different approach. But all of us want to make sure that atlas is in alignment. So again, we are in alignment when it comes to our ultimate goal. We just have chosen, I was introduced to orthospinology first. So, and that resonated well with me. And that's why I chose to practice that particular one. I'm so involved in orthospinology right now that I'm actually vice president of the Society of Orthospinology. So I'm taking that role very seriously as well. So if you want to find a practitioner that practices orthospinology, you can go to orthospinology.org, and you can actually look for a practitioner in your area there as well.
That's great to know.
So yeah. So what was your question again? I'm sorry, I got a little
Yeah,
excited there.
what were the outcomes? So using this
Oh, outcomes.
orthospinology techniques, and
Yes.
what were the outcomes?
So what so we already talked about the baby. So I thought that was pretty fun. And there's several different ones that I think probably are near and dear to my heart. So one of them was a woman, triathlete. You know, she actually found upper cervical chiropractic many years prior to seeing me. She found it after an auto accident. She had a severe whiplash injury, and after that injury, she started developing tremors in her hands and in her feet and her legs.
Mhm.
And of course, they want to make sure they ruled out Parkinson's, MS, any sort of tremor related, neurodegenerative disorder. And none of them showed up. She was clear of all that. And they're like, oh, I don't know. I'm not really sure exactly what's going on. Well, she did some digging. She's a researcher, so it's kind of fun. And she found upper cervical chiropractic. So she went to this upper cervical chiropractor and she got adjusted. And guess what? The tremors went away. And she got periodic care here and there. And she did fine, but back to being a triathlete and doing all of her fun stuff. And then she went is another car accident and a whiplash injury. Guess what? Tremors came back. And she's like, aha, I know what I need to do. I don't need to go do all this other stuff. This is what I need to do. So she was already well informed when she came into the office. But I had never seen this before. I mean, I've had people with Parkinson's, but advanced Parkinson's. So they had already had a lot of damage already, which it did help a bit, but we didn't see a complete reversal at that point. But she came in and I'm like, okay. So I asked her all the same questions. Have you gotten this taken care of? You looked at that? All this ruled out. She's like, I did all that already. I know what I need. So we did her first Atlas alignment, and guess what? I actually have, I've got to find it. We actually did a video of before and after of her hand tremors. It was like this. And then after we did immediately following that alignment, she could hold her hand pretty steady. Still a little bit of a tremor, but she could hold it pretty steady. So I thought that was really cool. It's like, oh, this is so cool. So I get really excited about that one. So she's a regular patient. She keeps up and makes sure her Atlas is in alignment, and she travels all around the world, and she does her lovely triathlons. So I thought that's pretty fun. Another one is called, I'm not even sure a lot of people have even heard of this before. It's called cyclical vomiting syndrome. Have you ever heard of that before?
No, I have not.
Well, it's horrible. Okay, it's typically in children, but we have seen everyone from a 6-year-old all the way up to, I think she's like in her early 70s. So we've seen several different patients with this. But the 6-year-old just is near and dear to my heart, just a sweet little baby. And she came into our office because she actually was friends with a patient that her daughter came in to see us. Though she was about 9 years old when this other child came in, and she had complete resolution of her cyclical vomiting syndrome. So what this is, it is out of nowhere, typically pretty, they call it cyclical because it occurs every week, every 2 weeks, every 3 weeks. It's like all of a sudden it comes on. And I don't know the timing and why, but that's why this is such an interesting thing. And so this particular little child, she came in when she was 6 years old to our office. She's presented to our office, but she was diagnosed a year previous. So basically what they give her was antiemetics, anti-nausea meds, IV fluids if needed. So what was some of the other things that they gave her? Basically just go home and rest. We don't know why. And so she came into our office. She was old enough to get some really decent films on her. So we got some good films on her. We adjusted her. And at that point in time, it was actually getting worse. She was having these vomiting episodes every week, and they would last almost all week. She'd maybe have a day or two of reprieve. So, think about, she's 6 years old, just started, kindergarten, right? She was in and out of school all the time. She was suffering from anxiety because she never knew it was going to happen. And severe, like stomach pains, severe spasms, headaches, you name it because of this. And she's 6, it started when she was 5. And so after that first one, she didn't have another one. It just stopped. It stopped. Now, she's only had, I think she's seeing us on a periodic basis, I guess now she's almost on her 3rd year. Just make sure her Atlas is staying in alignment. And she knows, Mom, we need to make sure we go, because she starts to feel that pain. She's very in tune with her body
Mhm.
now. And the only other time that it started back up again was when she went to a birthday party at a trampoline park, and she fell and she hit her head. And her atlas went out of alignment. And the next day, the vomiting started. Mom brought her in. We got her atlas aligned, and she was good to go. So that, to me, I mean, her life came back. I mean, I have another one that dealt with this for a decade. She's in her 50s, and she dealt with it for a decade. Every 3 weeks, she'd have an attack. Every 3 weeks for a decade,
That's
until
I
she
can't
started
imagine. I can't
under upper
imagine.
cervical. I can't imagine it. I can't imagine it. Let's see. So those are some of the really good ones. We actually had one recently with vertigo.
Mm.
So she's had vertigo, gosh, since she was 12, and I want to say she's in her mid 40s now. She's been diagnosed with chronic fatigue and fibromyalgia as well. Um, Now, she went to every doctor, all clear, ENT, neurologists, all sorts of stuff. Been given the all clear. So there was nothing underlying that was, like she had to really deal with. Like there wasn't a tumor in her brain, there wasn't anything like that.
Mhm.
She went to vestibular PT, which is actually very helpful for some people, but it doesn't help what's happening here. So in combination, vestibular PT could actually be very helpful to people with vertigo and dizziness. Um, so 8 months prior to this starting back up again, she had a fall, and it really ramped up. Like it only came periodically during this time, over this past 12 years, but it just ramped up to where it was every day. It was chronic. And she finally said, okay, I got to figure something out. So she found our office, and after 2 weeks, we finally got her stable. Her atlas was holding, and she hasn't had another. And this has been since April. She hasn't had another attack.
Wow.
So that was really cool. And now what we're doing now is we're helping her low back pain, which is pretty easy. So the main thing she came in with, that has resolved, and now we're just making sure that the rest of her spine is treating her well as well.
Yeah,
So
these
those are
stories
some
are
things that
amazing.
we've seen. Yeah, just recently in our office. So it gets more and more fun every single day, because we get to see, when patients are, have these things, they can't live their life purpose. They can't do what they want to do with their lives because they're constantly struggling with some sort of health issue. If we can help them just find that purpose and to live it, I mean, that ripple effect of that person affecting everybody else around them, that's what health is, right? That's what health is. The
Exactly.
health of a person affects the health of the community, helps the affect the state, of a country. So it's that ripple effect that I like to see occur with patients, because that just gives me so much joy, and know that I'm on the right path with my own purpose as well.
And that's one of the reasons that I'm motivated to do this, because a lot more people need to know this, instead of going through all that time trying to figure out, and then when there's no hope, no. And sometimes they go to a chiropractor at the end when they haven't found any results with. So if we can start from there, maybe we can prevent
Yeah,
getting all that struggles of looking for answers. And that's why I'm so
exactly.
determined to get this out, so we can give answers of and hope to people, so they can have the
Yeah,
resources to find solutions.
exactly.
um, mhm. Can you elaborate on the connection between the upper cervical chiropractic care and alleviating chronic pain?
Yes. So chronic pain, again, could have many underlying. I mean, again, that is probably one of the biggest onions we have to peel in our office. But again, we're starting with the nervous system, because when it comes to especially something like fibromyalgia, I mean, that would be probably one of the biggest catch-alls as far as chronic pain is concerned. Because I mean, I've had some patients that were diagnosed with fibromyalgia that if you even touch their skin, they jump. And it's really unfortunate because as human beings, we need touch. So not only are they deprived of human touch and human contact, but they're afraid of it. That to me is not okay. And so when we look at the nervous system itself, and we're looking how the brain connects to the rest of the body, this area is a choke point. The atlas region is a choke point when it comes to the brain being able to connect to the body and the body being able to connect to the brain. So when it comes to chronic pain, I'm sure you've probably heard before that pain is determined in the brain. That's where pain comes from. So we're able to determine, okay, did that really hurt, or is that something that we can brush off? You put your hand on a hot stove, your brain is going to tell you, ooh, no, that's not okay. That's going to do a lot of damage. But if you fall and scrape your knee, you're like, okay, I can go clean it off and get a Band-Aid and you'll be fine. You're not going to freak out. But have you ever seen somebody that does freak out over a skinned knee? It's how we perceive and how we process pain, probably from a very, very young age, and how we're conditioned sometimes can cause a lot of this too. So we're looking at not only the structural issues, but we also have to get a good understanding of how that person processes pain, because it's, again, no two people heal exactly the same way. We need to approach patients in a different manner if they've always had, aversion to pain or a very low pain tolerance. Then what we need to do is we have to make sure that we approach that patient a little differently than to somebody who has a high pain tolerance and is just like, let's get her done, doc. We see those patients too. So chronic pain, we had to find out, first of all, what is the cause? Where is it coming from? So in our office, we do nervous system scans. So all day long, we can, chase people's symptoms all over the place, but that's typically is a very futile approach because the nervous system is very elusive. We need to find out where it's coming from. So say, for instance, chronic low back pain. 85% of people are going to have some sort of low back pain in their lifetime, especially now that we sit all day. So those are some of my favorite patients too, because when they come in, I'm like, I'm not touching your low back at first. I mean, the first adjustment is atlas only. I mean, that's just the way it is. But then I show them how when the atlas goes out of alignment, it causes that muscle spasm one side. It torques that hip, it lifts that leg up, and it can cause all sorts of misalignment in the pelvis that can be causing their sciatica, that can be causing their low back pain that they've had for 20 years. So we got to turn the master breaker on here, relax the whole body. And again, you can see this on my website where you can see the changes that take place. You can mess around with that little misalignment, my misalignment tool that will show you how this area affects the low back. I can crank on your low back all day long. But if this area is not in proper alignment, neurologically speaking, we're not going to see the change. So our scans, what they do, we do a thermography scan. The thermography scan looks at the difference in temperature on either side of the spine, right where those nerves exit. That tells us, are there any inflammation that are going to the nerves, to your organs and your glands? Okay, so we start there. Then what we do is we do a surface electromyograph or surface EMG. What that does is it tells us, okay, how are your motor nervous system nerves doing? So it's the motor imbalance is what we're looking for, the muscles in balance. So we do that scan to see exactly how those nerves are firing. The last scan that we do is called heart rate variability. This is now one of the gold standards to determine how your autonomic nervous system is functioning. So we take all this into account and we look at this scan and we go, okay, this is where it's coming from. A patient can literally only tell me 10% of what's going on. Just 10%. There's only 10% of your nerve fibers in your body that are allocated to pain. 90% you can't feel, which is great because we don't want to feel, if we're cell dividing in our body. We want to make sure that we're getting the information that we need. So what we do is we take all this information, we give this to the patient, we say, look, this is where it's coming from, this is our roadmap, this is where we need to start. So therefore, they have a clear understanding. So this low back patient that comes in, chronic low back pain for 20 years, comes in, and we see that, and we go, okay, they'll get an understanding as to why I'm not going to touch this. I'm going to only adjust here and not going to touch your low back right now. So, but they get to see and feel the difference immediately following. Like I have patients that have low back pain, have them lie on their back prior to their atlas alignment and have them lift their legs. One leg can't lift very high, or it causes more low back pain. I adjust that atlas. I have them do that again, and they're Rockettes. They're like this with their legs. So we see those changes every day, and that smile, that goofy little smile they get on their face, and they look at me like, oh my gosh, that little tap back here did that? That never gets old. So I get to see that all the time.
That must be so fulfilling to see that every day. You love your job,
Every
I
day.
can
It's so fun.
tell.
Yeah.
So, could you discuss how certain lifestyle changes can help individuals that are suffering from chronic pain conditions?
Well, I mean, first of all, let's look at the nervous system. I'm never going to stop saying that. That's the foundation. So if you think of lifestyle as a pyramid, and what we have is we have the basis of health, the base there as nervous system health. We just start there, evaluate that, see how that's doing. And there could be some other things that we need to look at there, maybe some other practitioners that may have to do other examinations as well. So we can collaborate with neurologists, PT, things like that. But we need to see the health of the nervous system first. Let's start there. Then on top of that, then we need to start giving the body the nutrition that it needs. So again, we touched on this already. Where is that patient at? Are they more comfortable taking supplements? Are they more comfortable just, adding in some good foods or taking away some of the bad foods that they're eating? Then we can move into things like detoxification. We have an ion foot bath at our office to kind of chelate some of those things out of the body if there's heavy metal toxins or things like that we need to get rid of. We have a 21-day purification program that we offer to patients as well to kind of, again, help get the inflammation out of the body and create healthy habits over 21 days. Remember, 3 weeks is what it takes. So we do that. And then on top of that, we help them with some of the sleep issues that we talked about. We talk about the exercises that we talk about. And then at the pinnacle, once we create this strong foundation, then we can start talking about, how can you help yourself with your purpose? How can you get there? If we build this strong foundation, we can start getting them to think about, okay, what is your purpose in life? And then once they understand what their purpose in life is, they're going to just blossom. It's amazing to see how a patient just starts in from this kind of an infant stage to where their nervous system isn't firing properly, their body isn't healthy, they're breaking down faster than they're healing, and all of a sudden you see this life blossom in a person. You get to see, it's like I said, it's like a pyramid. People just blossom, and it's just really neat to see. But the stages are really important, and some patients have to stay in a certain stage for a long period of time before they make it to the next. But just giving them that we call it future pacing. Just give them that little seed of change each and every time. And once they see it, once they see they can do it, people have all the answers in for everything. They just have to be given the encouragement or even just the thought process to be able to make it to that next stage. So each and every one, there's no formula really. It's just making sure that you create the space for patients to move at their own pace. Slow and steady wins the race every time. We don't want to run to the finish line. The finish line is death. Let's enjoy this journey. We want to make sure that we enjoy each and every step, and we're not trudging up a hill. It's just a slow and steady pace. to health. That's how we approach it in our office.
Yeah, it's a great way to do it. And just the fact that you're trying to help them find a purpose in life, that will make a huge
Mhm.
difference in whether they do it or not. And I like I wish more physicians and doctors and chiropractors work together, collaborating with each other. That word
Mhm.
collaboration, because that will make a huge difference. There's a lot of isolated professions, and when you work together, many things could be accomplished. In your experience, what are the most common misconception people have about chiropractor care, especially regarding the upper cervical chiropractor care?
Well, I mean, chiropractic in general is that, and I'll just say it right out, they call us quacks. And I'm okay with that. I am perfectly fine with that. And it's not because I think they're right. I think it's just because they're ignorant as to our schooling. They don't understand how something so simple can make such an impact. Because in medicine in general, we're taught that your allopathic medicine is difficult, it's hard, it's complex. Well, in some cases, there's a complexities to the human body all the way around. But if we really just kind of bring it to its core and understand and that the human body is an amazing machine, that when given the right information, it knows exactly what to do and exactly how to heal. um, that breaks it down so much better. I can't tell you any patients walk into my office and they get that first report and they go, why haven't I heard of this before? This makes sense. What have I been doing for the past 20 years? And I hear that on a daily basis. I kid you not. They've been to umpteen doctors, and those doctors were doing what they do within their scope of practice, and they probably are brilliant and they are great at what they do. But when a patient isn't getting well, they don't know to refer to an upper cervical chiropractor. They don't know to do that. So again, one of my things, just like you said, is collaboration. Why can't we start talking? There are things that they do that I don't do. I can tell you that I've found things on x-rays and I'm like, I am not touching that spine. You need to go to this doctor first. This does not look right. This looks like an infection. This looks like cancer. I need you to get this checked out first. Right? That's out of my scope. I need you to go to this particular doctor and do that. So we do have, doctors that we refer to. So when it comes to making sure that people understand what chiropractors do, and it's first of all acknowledging that, people think we kill people or cause strokes, things like that. You've got to put it out there. You've got to acknowledge what people are thinking when they come into your office, because sometimes they're scared. And that's the reason why they haven't tried chiropractic yet. It's important for patients to understand that we have a very good safety record when it comes to any sort of injuries that are associated with it. Now, I think that the majority of injuries that do periodically show up in the chiropractic profession are typically because one, maybe a patient hasn't been forthcoming with maybe something that happened. I've had patients that come in that after they're done adjusting, they just told me they were in an auto accident, 2 days before. I need to know that prior, because we would have done scans, we've done things like that. So we train our patients to make sure they tell us everything that's happened: slips, falls, head injuries, auto accidents, things like that. Or, maybe imaging hasn't been done. I will not touch a patient unless I've done some testing and some imaging. I need to know what's happening on the inside. I've had a patient, a young kid that he was jumping off a bridge into water because he thought it was a good idea. Him and his buddies were doing this. So he hit the water really hard, had some mid-back pain, but, it was getting better. It really wasn't really that bad. But I'm like, I'm taking a picture. And he had a fracture. What if I would have said, okay, well, it's getting better. Let's just go in there and adjust it. I could have paralyzed them. So it's really the due diligence of not only the doctor, but of the patient as well. Patient has to tell the doctor the information that they need to know in order to make sure we do the right diagnostic work. So any patient that comes in is afraid of what we do. First of all, in our office anyway, we don't do any of the rotary movements with the neck. Not that I think that it's dangerous. It's not conducive to what we do as upper cervical chiropractors. We're talking precision. We are talking gentle care. That's what we do in our office. And we're talking about corrective care. It's not how many pops and clicks we can get. It is how well is the atlas holding. Number two, are the segments moving properly? If they're not moving properly, then we actually use something that is called an activator. Or the clicker. That's again precise and gentle. We can use it anything from infants all the way up to our geriatric patients with osteoporosis. So it's something that's a tool that helps us be as precise and gentle as possible. And so I tell patients that and let them know that after that first atlas alignment, they could be sore. We're affecting a lot of postural muscles. They could be a little sleepy. We have some detox responses sometimes where patients get a little loose stool. So there are some things that do take place, but we are, first of all, forthcoming about what we've heard. We know that's all right. We're the redheaded stepchildren of the healthcare industry. It's all right. And but we also give them, the assurance that what we're doing is very safe, it's very gentle, and that we're going to do our due diligence to make sure that we do all the diagnostics we need to rule anything out that may preclude them from getting a chiropractic adjustment. So that's what we do in our office, and I think it works.
And if it works, have given us a lot of, examples or results that your patients have had. That's for me. It was very simple. That was many, many years ago when I found out this. My son is 38, and this was when he was 2 years old, which I was not that educated on. But it made sense what the chiropractor says versus all the medical doctors, the hospitals, the ERs, everything they're treating my son when I would bring him with the seizures, and they couldn't do anything, just prescribe, and not giving me any reason.
Right.
So it made sense. So I made the choice, the decision to just take him out of the hospital and continue. And that was the best. And my son still goes to a chiropractor, and we all do.
Oh,
So,
good for him.
and talking about education, how do you incorporate patient education into your practice, especially when discussing the benefits and potential risks of the upper cervical chiropractic care?
So in my office, what we do is we don't adjust on the first day. I think part of patient education is really important for them to understand, again, like I mentioned earlier, that we are doing our due diligence. The first day we gather information, that is the diagnostic day, where we are looking top to bottom. We're doing a consultation, a thorough history. We do the scans that I mentioned. We do the films. We do a posture check. I do palpation to get feedback from the patient. What's moving, what's not. Have them give me feedback into what hurts. And all this is written up, and then we create a report. So then they come back for 2 visits. The first visit after that initial diagnostic visit is their report. We sit knee to knee with our patients. We have them look over their films. I explain to them what I'm seeing. We correlate it. That actually, I don't even have to correlate it. They're going, well, that's why I feel that way. I mean, they can figure it out for themselves. They actually can see it. They can look at it. It's something tangible that they can finally put their hands on as to why they're feeling that way. We actually call it their why. We give them hope, because we're going to say, you know what? It's been 10 years you've been suffering from this. This is way too long. We're going to give you your why. And if for some reason we can't help you, we will find somebody that can. And so if they do qualify, if there's no bells or whistles that would preclude them from an atlas alignment, That same day, we do their first atlas alignment. After that atlas alignment, we do post diagnostics. So the proof is in the post, is what we always say. We want to make sure that we're actually doing what we set out to do. So not only do we do a post posture picture to see how those muscles respond, we also do post films. I want to see where that bone went. I want to make sure that we got a good correction. So we look at the before and the after of those films, and we can show that patient, you went from here to here, and that's good. That's what we want to see. We talk about, and that's what we do in that second visit then. Well, I guess it'd be technically the third visit they're coming into our office. That's their follow-up. We talk about, okay, how did you do after your first atlas adjustment? What did you feel? What changes did you notice? How did you sleep? Were you sore? All those things we want to ask. Then we show them their befores and their afters. We even do another scan, a thermography scan, that day they come back in for their follow-up to see exactly how the nervous system has calmed down. And we look at those pre and post as well. And then from there, now that I have all this information, I can put together a care plan. So that's we recommend their personalized care plan. So it is a step-by-step approach. We don't give everything to them. We don't adjust them on the first day because, first of all, we don't know whether they qualify for care yet. We don't know whether they have an atlas misalignment. We don't know whether they have other areas that are compromised. We don't know whether something else is a contributory factor to what they've got going on. So we have to gain all that information. So when we do sit down with a patient, they become educated about what's going on with their body, but they also become a team player in it. This is not me, the doctor, telling you what to do. This is us as a team getting together to figure out how we're going to move forward. When we talk about what's next and we talk about the care plan, they get to build their program. The program is based on that foundation of chiropractic care and getting the nervous system healthy. Then we talk about progress exams are really important. That's the foundation. Those are the two things that we will not compromise on, is the chiropractic adjustment as well as the progress exams. Those are two things that are needed in care. Everything else, whether it be therapies, whether it be detoxification programs, nutrition, those are things that they can add into their program as they see fit. If I feel something is quite necessary, like maybe some therapies to help them feel better faster because they're in such chronic pain, I will recommend that as well. But again, this is their journey. They need to start where they feel most comfortable. They came in for chiropractic care. That's why they came in. So that's going to be the foundation. That's the most important thing we do in our office. Then, of course, the progress exams. Well, we have to know how they're progressing. So we have to do those. But everything else, I think, can be very important and can be very, very helpful. But that is up to the patient to make that determination. We need to make sure that they are getting exactly what they walked in the office for.
That's once they understand why it's happening, when you explain and show them, literally with, they can see that there's gonna be a better result if they continue the program and the plan, and then you feel more invested in doing something like that. And that's something I experienced
They're
over and
investing
over
in
with the
themselves.
themselves. Exactly. And
Yeah.
what I like, and if there's something that you cannot do, you're very honest, because my chiropractors have been very honest. Okay, this is something that I'm going to refer you. There's a team or network. They refer you to a specialist when they've done
Exactly.
everything they can.
Exactly.
So
I don't want to do everything.
and that's the message I want to give out there, that they could trust chiropractors, and this misconception, it's not valid. I mean, there's more benefits to really try to find out for on your own that this really works. um you have given us, one of my questions is, if you had some success stories, and you had given us a lot of uh, successes, but if there's something, another success story that you've had that you want to share with us, um, stories that particularly
Let's see.
resonated with throughout all your career. You gave us just the story and how you
Yeah.
became a
I mean,
chiropractor?
there are so many. I mean, right now, thinking of one right now to come up at the top of my head is kind of hard. But oh yes, I do have one. I have a really good one. Um, so um, this young lady has been diagnosed with mast cell activation. She has Lyme, um, Hashimoto's thyroiditis. I mean, you can even tell when she gets out of alignment, you can see her thyroid blow up. I mean, you can see it in front of you, you can see it blow up. Um, and possibly we're looking at maybe Ehlers-Danlos syndrome, which is a ligament laxity issue. It's a genetic condition. So there's like multiple stacks of things that she came into my office with, and she's been to other doctors, she's been to other chiropractors, she found upper cervical, and it was rough at first. It was really rough for her at first, because when the ligaments up here, when they are really lax, um, the atlas doesn't want to hold as well, because remember, the atlas has no disc anchoring it into place. It's just held together by those web of ligaments, and if those ligaments are really lax, it's going to go out of alignment a lot more. So she stuck with it, though. She stuck with it, and she is such a trooper. Um, just an amazing, amazing woman. She's got beautiful children, and she wants to be the greatest mom ever. And it's hard when you're constantly in pain. It's hard when you can't think. It's hard when your whole body feels like it's just piling against you. But um, as of, let's see, she's now gone over a year now without her atlas being out of alignment.
Wow.
So now I want to say that in her case, she also has a great PT that is helping her as well. So again, this is where the collaboration comes in.
Hmm.
And so once we started really kind of getting together with the PT doing her part and her doing at home stuff, we talking about different foods, and she's now holding her atlas alignment for over a year, and she's doing fabulous. She actually even went on vacation and didn't go out of alignment and enjoyed her vacation with her family. So you have those types of stories that really hit home, and we celebrate. We check her atlas and we celebrate it, that she doesn't need an adjustment that day. That's the cool part. She's like, yes. And she drives like an hour to come one way, and she comes into the office hoping that I don't need to touch her. So that that's huge.
Yes.
So it's a really an incredible feeling when you see a patient now, again, like I mentioned earlier, just living their purpose, her being a mom to her kids and being able to experience, their lives through their eyes and be present is really important, without just being in bed all the time. So
That's great.
that's probably another one that I really love. Yeah.
Well, thank you so much, Dr. Taylor, for sharing all these stories and all this information and knowledge about what chiropractors do and are. And if you look at the audience right now, can you give us what words of hope could you give us?
Well, that's the first thing that we give our patients. When I go through a consultation with our patients, that first connection that you have with that person, and desperation is typically what I see, because again, typically their last stop.
Yeah.
But hope is really the number one thing we give. I look at them. I mean, we have a lot of hugging in our office, and I don't know about any other office, but for some reason we just have this thing about hugging. If you don't like hugs, I won't hug you. But it's just one of those things that you have that connection with the patient, and you hear their story, and sometimes there's tears. I mean, today there was just tears. Somebody's breaking down, and it wasn't a bad cry. It was, I'm in the right place cry. I think I've finally found my answers, and I haven't even touched her yet. you know you have to. That's why I do what I do in the mornings. I do my journaling. I get everything out. I have bad days too. I have bad weeks, months. We all do. We're human. But when it comes to walking in that office, there are no patients in there that are going to know if I'm having a bad day, because they're coming in there for my help. Sitting down with that patient, connecting with that patient, figuring out not only what their goals are and their motivation is to be in our office, but also to let them know they're in the right place.
Yes.
That's what brings hope to a patient. Now, and I always say at the very end, if I can't help you, we will find somebody who can.
Mhm.
So we never overpromise and underdeliver. We always want to make sure that each and every patient gets the care that they need, whether it's in our office or somebody else's, because it's not about us. It's about that patient that's in front of us at that moment. So giving hope to a patient is probably, I think it's our number one thing that we do in our office very, very well.
Thank you so much. Those are wonderful words that will help the world. And the world right now needs those kinds of words and of hope, because a
Yeah,
lot of people are looking for the right place. And I think you have a wonderful place where many people will go and find the answers they're looking for. Thank you so much,
I
Dr.
hope so.
Taylor, for all of this time you've given us.